the point of this series is to talk about leading a wellness-based lifestyle and the different components of what that looks like. So we know that exercise, health, and health in general, mental health awareness, keeping your stress level down, being able to stay hydrated, eat proper nutrients, are all going to be areas of that wellness-based lifestyle. I also like to include in there toxin-free living because we know that's going to directly impact a lot of the different systems of our body. So in this series, we're going to kind of be breaking down each of those topics and just having discussions about it to make it feel more approachable and not as shoulds, but when you have the knowledge for why, then it's a lot easier to incorporate the small changes that help with leading that more wellness-based lifestyle. So today we're going to be talking about exercise. And sometimes we need to reframe exercise and why are we participating in exercise and what does that look like? So exercise just means moving your body. It doesn't mean anything really more than that. Exercise could be doing repetitive squats while you're gardening. So that could be exercise. Exercise could be lifting very heavy weight. That's exercise. It's also going for a run, going for a bike ride. There's lots of ways to exercise. So let's break that down a little bit. Let's talk about what are the areas of exercise and what really should be included in that day-to-day process, or what's included in the week and how that week progresses throughout all the different areas. So when we're talking about over the course of a week, and then we'll kind of go into a day. So over the course of a week, what we're really looking for is we want to be completing cardiovascular exercise. We also would like to be completing strengthening as well as stretching and mobility. And so those are three different ways of moving. And oftentimes what happens is we put all of our eggs into one basket. So if you really like cardio, then you'll be hitting up cardio a good bit, but then you're not stretching and strengthening. If you're somebody that really likes to strengthen, so you're good on the strengthening, but then you're not stretching and then doing the cardio. If you're somebody that loves to stretch, same thing. You're stretching all the time, but you're not strengthening and you're not doing cardio. And so this just leads to an imbalanced relationship with exercise. The goal is to figure out how can you add what we call cross-training to your week in order to make sure that you're meeting your body's needs. So first we have to understand what's the why behind each of these categories. So the why behind cardiovascular exercise. All that means is that you're elevating your heart rate during the activity and you're keeping your heart rate elevated for an extended period of time. Ideally, you work up to this, but ideally this is 30 minutes of keeping the heart rate elevated. It literally doesn't matter how you do that. The whole point is that the heart rate is elevated. And what that really means is that you're going to be increasing your respiration rate, so your breathing rate goes up. That's going to put work onto the heart and lungs, and that's what keeps your heart and lungs healthy. And so if we don't put challenges onto our body, especially as we age, but this is super important when you're younger as well, then the system isn't as strong. This is anywhere in life, right? If you don't challenge yourself with learning, you're never going to learn more. If you don't challenge your cardiovascular system, it won't stay strong and it won't progress. Same thing with strength, same thing with literally everything else in life. When you put the challenge on, your body rises to the challenge. Otherwise, it will continue to meet the challenges that you place on it, which if it's low level, your body will perform at a low level. Just how it works. The other thing that cardiovascular exercise helps with is overall circulating blood throughout your body. Now, why this is good is it actually helps your organ systems stay perfused with the nutrients that they need. It helps with your nervous system, brain and spinal cord. So overall, it's just going to keep your body flushed because essentially what's happening is our arteries are going to bring the nutrients to the different areas of our body that need them. And then the waste or toxins or anything else that isn't needed anymore is going to be returned back to the heart via the venous system. And then we exhale out carbon dioxide as we breathe. And so that's our lungs exhaling out what we don't need. Then anything else in our body that we don't end up needing, we excrete via urine and feces. And so we have our different systems of getting stuff out and our different systems for bringing things in. And so cardiovascular exercise, again, it just means elevate the heart rate for an extended period. The goal each week is to have 150 minutes of activity where the heart rate is in a sustained elevated state. Like I said, at least 30 minutes is the goal to work towards. So if you do that 5 days a week for 30 minutes, that's your 150 minutes. It could be one day you do an hour, other days you do 30 minutes. Overall, it's just that culmination of 150 minutes throughout the week. Really, doing things that you enjoy is the only way that you're going to be able to sustain this as a lifestyle change. I enjoy running, right? So that's my thing. I really enjoy it. It checks a lot of boxes for me. Running gets my cardiovascular exercise. I have a running partner, and so that gives me a social connection as well. I really enjoy that. And it also kind of puts me into, especially when I'm running by myself, I kind of get into a bit of a meditative state with the breathing rate. I do 2 breaths in, 2 breaths out. So as I run and as I get into that rhythm, it really actually helps to stimulate that parasympathetic nervous system, which is the calming nervous system. And it really helps as I kind of process my day or whatever. Maybe I've got something that's been on my mind. I can't quite place what is bothering me. I just feel like something's going on. I can go for a run, get into that breathing rate, and 9 times out of 10, I will come home and be like, okay, I can put my finger on it. This is what's going on. And then I can start to make a plan for how to address it. So running checks those boxes, but for other people, it might be biking. It might be going for a walk. It might be getting on the elliptical, the rower. Literally anything is fine. So that's cardiovascular exercise. So that's one of the categories of exercise. We also have strength and we also have stretching/mobility. So when we think about strength, what we want to think about there is the goal is going to be 2 to 3 days a week of strength training, because you really want to make sure that you're giving your body the recovery days. Because when we strengthen, essentially what you're doing is you're breaking down the muscle in order for it to repair in a stronger state. So what happens with overuse injuries is when you're in a broken down state and you haven't really repaired yet, and then you break it down further, and then you break it down further, and you break it down further. So that's the key with making sure that you're changing up the stressors that you're putting on your body. Because you can have active recovery days where you're working on a different category of exercise, and so you can really push in each of your categories, but just kind of break it up throughout the course of the week. That's what the term cross-training means, is that if we have a long run day, then we don't really want to stack that necessarily, right, onto another long run day the very next day. The next day we might do strength or, things like that. So then we kind of put the run day and we'll just kind of stagger them out like that. So now back to strength. So with strength training, we want to try and think about strengthening the muscles that are all over the body. So we don't want to put all of our eggs just into the basket of arms and then forget about legs, or core but then forget about mid-back. You really want to think about strengthening in a way that you're thinking about the whole body. And then that way you're going to be keeping your joints and muscles and ligaments and all of these other great things in our body strong. And strong gets you more resilience to things that happen, which are the insults that our body takes. So it could be that I'm driving in my car and then, bam, I've got some sort of impact. Now, if I'm really, really loosey-goosey in my neck and I have that big whiplash injury, I'm going to sustain more damage. If I have strength in the neck muscles, yes, it's going to cause injury, but the injury won't be as much. Same thing with like, let's say I have a slip and fall and I catch myself on, on an outstretched arm. Well, if I already have a weak shoulder and then I give it a big insult, I'm more likely to sustain a tear. I'm less likely to sustain a tear if I have a strong shoulder that can take that impact. So it's just things like that. It doesn't prevent you from having like injuries or things happen in life. It just improves the resiliency and improves your ability to be able to withstand life's challenges, because they're going to happen. It doesn't, like, nobody gets through life without messiness. So you just try and stay prepped as much as you can. So how you do whole body strengthening just depends on you. If you are somebody that likes to go to the gym, there could be a personal trainer that you work with, and that might be your jam. It could be that you like going to classes, and because there's a community feel of going to a class, that's great. It could be that you do something on your own and you watch videos, right? That's fine as well. So I like what's called functional training. So it's all functional movements. So when I strengthen, I'm working in planes of motion, how my body normally moves. And so for me, it just works better. And so so essentially, like, through the clinic, we built out an app of all functional movement. And that way we can help support people with functional movement and learn how to strengthen that way and stay supported. There's a community thing in there and all sorts of fun stuff. And so that's kind of like, overall, it's going to help keep joints strong. It's going to, like, the muscles surrounding the joint strong, which helps to decrease the amount that joint takes impact. Because if the muscles take the impact, the joint takes less impact. So we can preserve our joints by keeping the muscles around the joints as strong as possible. And so again, the goal is 2 to 3 days a week. And ideally, you're spreading that out with the cardio. And you can combine them. Like, you could do 30 minutes of cardio and then 30 minutes of strengthening in the same day. That's totally fine. Just, meet yourself where you are and don't do more than what your body can handle. And then you can grow with all of it. Now let's talk about stretching and mobility. Stretching means that we are lengthening a muscle. So if you are actually going to stretch and you're really trying to get some length out of the muscle, you're going to have to elongate that muscle for an extended period if you're expecting to get any sort of lasting effect. So muscles are contractile by nature. So if we put a stretch on it, think about a rubber band. We stretch that rubber band and it recoils right back to the same length. We didn't do anything to change the rubber band. It was like, all right, I stretched. Okay, I'm done now. Okay, but you didn't accomplish what you were looking to accomplish. So with the rubber band, if we put the tensile stretch onto that rubber band and hold it for a period, then when it recoils, it doesn't recoil as strong as it did. So you actually created deformity in the tissue. You changed it so that you get more length. So that's what we're looking for when we're talking about stretching, is we're trying to get some more length out of muscles, because when muscles are short, they end up compressing joints. And so common thing is somebody has low back pain. So often their hamstrings are crazy tight. So those tight hamstrings will tilt that pelvis in a posterior position, so backwards, like that kind of position is what tight hamstrings do. And the back exits off of the pelvis. So now that normal curve that you should have in your back starts to flatten out. Well, if that curve flattens out, now we don't have the spring effect that a normal curve of a spine will have. So when I'm standing, I'm walking, I'm running, that low back should have this nice little bounce to it. And then that way it stays nice and healthy. But when the pelvis tilts back and it flattens out, it has more impact. And that's what leads to breakdown. And so all of it is important, is the real answer. So taking time to stretch is key. Normally what I'll do is I'll put stretching in at the end of an activity when your muscles and tissues are nice and warm. And so that way really get the most benefit out of the stretching at that point. And so like an example for a stretch would be, I want to stretch my upper trap. It attaches from here to here. So if I tilt my head away and I bring my shoulder down, now I can get some elongation to that muscle. And so I'll hold this as long as I feel the stretch, which is not pain. That's just a pulling, just a tightness. So I'm going to hold that for at least 30 seconds. And then that way I'll actually start to get length out of that muscle. We can apply overpressure. We do this using a strap, like if we're stretching hamstrings or some of the hip muscles. For the muscles here, I can apply overpressure just by letting the weight of my arm pull my ear towards my shoulder. And so this way I'm actually getting a little bit more length out of that muscle than I was able to get with just active range of motion alone. And so there's a lot of different muscles to stretch and to keep moving. But overall, you're going to have much improved spine health, which includes the neck, the mid-back, and the low back, with keeping muscles elongated. So keeping the pecs opened up, things like that. Mobility falls into the category of stretching, but mobility is something where we're thinking more about the movement that's available through joints. And so spine, I keep coming back to spine because it's just so common that people get really stiff in the spine, whether it's, at what we call the thoracolumbar or the cervicothoracic junction, which is where the neck and the upper back meet. You see that hump that can form there. That's where we get stiffness in those joints. Same thing happens in the low back commonly, hips, big time, love to get stiff. And so mobility is where we're kind of going through some range of motion and doing that in a nice fluid manner. And then that way we kind of start to get all of the tissues surrounding the joints and the joints moving, and that is what flushes what we call synovial fluid around those joints, and the synovial fluid keeps the entire surface of the joint bathed with nutrients. And so again, if we're thinking about exercise and how do I implement this into my life, well, it can be quite simple. You do an active warm-up before you do your cardio or before you do your strengthening. And an active warm-up, can look a lot of different ways. I've got one that I'll share a video about that I really like for myself, and I use this with a lot of my patients as well. But that's a great way to kind of get started with your workout for the day, and you're getting your mobility box checked with that. Then you either do your cardio or your strengthening, and then you end with your stretching. And then on another day, you just swap out the cardio and the strength, but you still do your active warm-up for your mobility, and you do your stretching at the end. And so if you just build out your day to warm it up, move somehow, stretch it, I promise, it doesn't become complicated. And now you're kind of getting all of those benefits of keeping the joints strong, keeping your cardiovascular system strong, keeping the muscles themselves strong and mobile. So it helps you with overall performance of activity currently in the day-to-day. It helps you with prevention of injury or just degenerative changes that do not always need to happen. Okay, sometimes you just are predisposed. It is what it is. You can't prevent everything bad in life, but what we can do is best prepare our bodies to be able to go through the aging process with less quick breakdown, right? So that breakdown that you don't need to have arthritic changes at such a young age. You don't need to necessarily be looking at spine surgery if, like 20 years prior, you had been really diligent about keeping hamstring length, strong core, just overall good motion available through the spine that could have prevented that. So not everything that you learn will be preventative. It is what it is, but some of it can be. So implementing this kind of pattern into your life will help you now, it will help you in the future, and it helps every system of your body. It helps your nervous system, which is brain and spinal cord. It helps cardiovascular system, heart and lungs. It's going to help musculoskeletal system, which is bones and muscles, ligaments. It's going to help your endocrine system, which is kind of those hormones that are circulating. We want to make sure we're kind of decreasing chronic stress hormones and increasing those positive positive mood enhancing hormones. So that cardiovascular exercise really helps with those mood enhancing hormones and circulating those instead of those high stress hormones, which we know leads to breakdown in our body in a bunch of different areas. So we don't want that. We want to kind of get a better balance there. And so overall, these are all of the different reasons for why. Like, why do I move my body? Well, I move because I want to be healthy now, and I want to prevent illness and injury in the future. So if you make it about you, like, honestly, like, this is a you thing. It doesn't matter what you look like to the outside world. That's not why you exercise. If the only reason why you're exercising is because of how you look in a bathing suit or how big your muscles look in a certain shirt, it's not a sustainable practice, right? Like, you're doing it for somebody else. And so it's not, again, it's just not a long-term fix. Lifestyle change means you have knowledge and values for why you're doing something. And then you defend that in your schedule and you time block that in your schedule, because you know that if you get your movement in, it's going to help you. It's going to improve your mood. You're going to feel overall more energized, and you know that you're building yourself up to prepare yourself for life's challenges that always are going to happen. So it's a lot easier to now incorporate that in. So if you have just questions, you're like, I just still feel like I don't even know where to start. Like I said, we have an app that helps with incorporating all of this. If you already have a gym, use your gym. If you have a walking partner, use your walking partner as your accountability partner. There's all sorts of different ways of doing this, but just know that you're doing the right thing by moving. You might just need to kind of fill it in a little bit more. Mobility, stretching, cardio, and strengthening, and then that way you're going to really get the most benefit out of exercise, and you'll get a healthy experience with exercise, which is the whole key. So each week I'll be kind of going into different topics. This is just one that's like, obviously as a physical therapist, I love movement, and I think it's so beneficial and so healthy, and I think oftentimes people just don't really have the most balanced experience with it, and sometimes really have a negative experience with it. And it doesn't need to be that way. It can be fun and healthy and full of laughter and work, but like not work to the point of like it's horrible. Like, it's actually enjoyable. So, like I said, I'll be diving into more topics, and if you have questions and you want to learn more, just write them in and I'll do a video to explain it, hopefully. Okay,